1 of every 49 women in Uganda die due to pregnancy-related causes.
Uganda is number 133, or if you can turn it around, we are around 35 worst country of the 170 for the mother, baby and child to survive.
This is one of the 5 indicators the latest report on the world's mothers based on to rank 178 countries. Rwanda does better than the other East African countries, coming at 121st, Tanzania at 135th, Kenya 143rd, Burundi 147th and South Sudan at 158th. Somalia is the worst country to be a mother according to the report. The other bottom 10 are all African countries. The other indicators include the under 5 mortality rate, expected number of years of formal schooling, gross national income per capita, and participation of women in national development. European countries like Finland, Norway and Australia were found to be the best places to be a mother.
They have access to healthcare services for all pregnant women at all the time, whenever they need it, and the kind of quality of care that they deserve. They have access to essential medicines and the medical equipment that are available. Health workers are available, and they have controlled their population. Uganda has one of the highest fertility rates. Our women are turning over children every time and then.
Patrick Aliganyura, the program specialist for saving newborn lives with Save the Children Uganda, says the report focuses on mothers and children surviving during humanitarian emergencies.
These settings are not any different, but rather they face aggravated issues when it comes to pregnancy, when it comes to childbirth, when it comes to issues of nutrition, breastfeeding, even surviving to the age of 5.
Uganda is listed among the top 51 fragile countries facing conflicts, natural disasters like floods, as well as refugee influx.
When such crises happen, the system is overridden. The system does not work in terms of health service delivery.
The Health Minister Rwanda does not share the opinion that Uganda is a fragile country.
On the contrary, Uganda is a dynamic country. It still has some challenges. It still has high indices of maternal mortality and maternal morbidity, but is confronting that situation.
But you're getting disasters, you know, the floods. What are we doing when the whole hospital goes down?
I'm not aware of any country in the world that is immunized from all sorts of natural calamities. Uganda, like other countries, when faced with such a situation, floods or others, we deal with it. You know how we have dealt with the situation in Kasese and in Bugisu, near Mbale.
Uganda is on track to realizing Millennium Development Goal number 4 of improving child health. Save the Children, however, says that children aged 0 to 28 days need special monitoring.
They contribute 33% of all under 5 mortality or under 5 deaths in the country.
In Uganda, under 5 mortality is at 69 of every 1,000 live births. South Sudan and Burundi at 104, Kenya at 73 and Tanzania, which is faring well, at 54, as well as Rwanda at 55 of every 1,000 live births. These are still high numbers compared to the top 10 countries which lose no more than 5 each. Florence Naluyimba, NTV.